Assalamu alaikum. What's up, guys? My name is Mohammed Sen. I am a second year student of International Medical University. My presentation is chemotherapy. Chemotherapy is a aggressive form of chemical drug therapy that is used to destroy rapid growing cells in the body, such as the cancer cell. Cancer actually is a disease in which some of the body cell grow uncontrollably and spread to other parts of the body. What is oncogenes? DNA repair gene are involved in fixing damaged DNA cell within mutation in these genes are tend to develop additional mutation in other genes and change in their chromosomes, such as duplication and delegation of chromosome parts. There are some genes like tumor suppressor gene. The tumor microenvironment is the environmental around a tumor, including the surrounding blood vessels, immune cells, fibroblasts, single molecules, and extracellular matrix. The tumor and the surrounding in micro are closely repeated and interconstructly. A tumor can influence the environment by releasing extracellular signals, promoting angiogenesis and including peripheral immune tolerance, while the immune cells in the microenvironment can affect the growth and evolution of cancer cell. Cancer spread from where it started to distal part of the body, that is called a metastatic cancer. From many type of cancers, that is type 1 cancer, type 2 and type 3 and type 4. These all are the stages, stage 1, stage 2, stage 3 and stage 4. The process by which cancer cells spread to other part of the body is called a metastasis. Many different type of chemotherapy or chemo drugs are used to treat cancer. These drugs are very different in their chemical composition, okay, how they are prescribed and given, how useful they are in treating certain type of cancer, and the side effect they might have every time. And many new cells is formed is and goes through a usual process to become fully functionally. Yeah, the process you involve a series of phases is called a cell cycle. Chemotherapy drugs target cells at different phases of cell cycle. Understanding this how these drugs work help doctors predict and which drug are likely to work well together. Cancer cells tend to form new cells more quickly than normal cells. And this make better than target for chemotherapy drug. However, chemo drugs can tell the difference between the healthy cells and the cancer cell. This means normal cells are damaged along with the cancer cell, and this cause side effects. Each time chemo is given, it means trying to find a balance between killing the cancer cells and sparing the normal cells. There are also some class of chemo drugs such as the alkylating agents, antimetabolites, anthracyclines, anti-tumor antibodies, corticosteroids, and other. There are such many different type of chemotherapy drugs which are used to destroy the growing cells in the body. Such as the first I want to discuss the alkylating agents. The alkylating agents keep the cells forming, reproducing, making copies of itself by damaging its DNA. These drugs work in all phases of the cell cycle and are used to treat many different cancers, including cancer of the lung, breast, and ovary, as well as the leukemia, uh, multiple myeloma and sarcoma, because these drugs actually damage the DNA and they affect the cell of the bone marrow, which make actually new blood cells. In rare case, this can lead to leukemia. The risk of leukemia from alkylating agents is dosing dependent, mean the risk is small with lower dose but goes up of the total amount of the drug use gets higher. And the risk of leukemia after getting alkylating agents is highest about 5 to 10 times greater than their treatment. And we discuss another type of class of chemo drug, such as cisplatin. This the mechanism of action of cisplatin has been associated with the ability to cross link with the urine base on the DNA to form DNA adducts, preventing repair of the DNA, leading to DNA damage and subsequently induce apoptosis within cancer cell. Administration rate has varied from 15 to 120 minute infusion, no, 6 to 8 hour infusion, 28 hour infusion or per protocol. Cancer of cervix, endometrium, esophagus, kidney, non-small cell cancer, head, neck, squamous cell cancer, such as this. Uh, I want to discuss another class of chemo drugs, such as antimetabolites. Antimetabolites interfere with the DNA and RNA by acting as a substitute for the normal building block of the RNA and DNA. When this happens, when the DNA do not make copies of itself and the cell cannot reproduce, they are commonly used to treat leukemia, cancer of the breast, ovary, and the intestinal tract, as well as other type of the cancer, such as the there are some other classes, such as decitabine, chloramine, and cladribine, and such as many others. And I want to discuss the last one is the antimicrotubule agents. Highly dynamic mitotic spindle microtubules are among the most successful target for anti-cancer therapy. Microtubule target drugs including paclitaxel and were previously considered to work primarily by increasing or decreasing the cellular microtubule mass. Although these effects might have a role in their chemotherapeutic action, at lower concentration, microtubule target drugs can suppress actually the action, lead to mitotic block and apoptosis. In addition to expanding array of the chemical diverse antibiotic agents, and some other microtubule target drugs can act as a vascular targeting agents, rapidly demolarizing microtubules of newly formed vasculature to shut down the blood supply to tumors. There are also lots of the class of chemicals such as chemtosir, and there are some also therapy, that is the hormone therapy, that is drug in this category work on different action of hormones that make some cancer also grow. These drugs that are used to actually slow the growth of breast, prostate, endometrial cancer, which normally grow in response to natural sex hormones in the body. And immunotherapy is also a type of treatment that use drug to boost or alter a person immune system. These drugs are used with certain type of other cancer to help a patient immune system recognize and attack cancer cells. These are all about the chemotherapy. I hope you understand well. Thank you so much.